Hey everyone. So this is going to be a mini lecture on counselor advocacy. Again, I'm Dr. Steve Kuniak, and uh, the field of counseling has certainly put a focus on this idea of advocacy over the years, and more so recently. Some of that is because as counselors, we certainly have an ethical responsibility to advocacy. Um, it's our job because counseling is a professional relationship, and we take that to heart. That's at the core of the work that we do. It becomes our job, our role to speak for those who may need their voices uplifted, to advocate for causes that will support those we serve. And then additionally, it becomes our role to advocate for the field of counseling as a whole. And this sort of stems from this idea that there are many degrees, many areas of concentration within this overarching field of helping and human services and mental health professions, but counseling specifically, we are somewhat newer in the history of the profession, and our name as a counselor gets used in a bunch of different places. Um, Attorneys are counselors. Sometimes pastoral or like religious officials are called counselors. There are camp counselors. And so the term counseling has been kind of diluted, gets used interchangeably with terms like therapist and so on and so forth. And so when we're attempting to advocate for things, it becomes part of our responsibility to be able to explain what a counselor is, so that the people who have the power and influence can utilize it properly and support us in the areas in which we need. So let's take a look at all of this. So this is the ACA's definition of professional counseling. I refer to it a lot. Like I mentioned in the intro there, counseling is a professional relationship, is right at the start of the definition. I'm appreciative of the fact that ACA sort of signed in this definition of professional counseling during their conference in Pittsburgh, right down the road from me here. I've been living and growing up in the shadow of Pittsburgh my whole life, and so it's just kind of a point of pride. But this definition has been in existence since 2010, and so if you Google definition of professional counseling, ACA, American Counseling Association definition of professional counseling, you'll find it right on the ACA's website. But whenever someone asks us what it means to be a professional counselor, or when they misidentify our degree or our license, and we correct it from no, I'm not a therapist, I'm a professional counselor, and they say, well, what's the difference? This is the difference. So I think it helps to know counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. That is our on our banners that we march to. So counselor identity, it's central to advocacy. So we talked about this a little bit. Why is having a definition of professional counseling so important to our work as advocates? Talked about who else calls themselves counselors. Whenever we are, say, trying to find support for a given cause that we are advocating for, if it's something that needs funding or needs some sort of legislative support, that means we have to go and talk to public officials, local, state, and federal government officials. If the terminology is not spelled out as it needs to be verbatim, it won't count. So like, I can speak to the fact that I was helping doing, with some advocacy efforts at the state level. We had a couple of state legislators who were, they had a great plan in place, good ideas for supporting the mental health community and supporting, schools in underprivileged areas, especially to gain more mental health support. And so they were going to write this bill, and funding was going to come through for licensed psychologists, licensed social workers, and licensed therapists. And in Pennsylvania, there are no licensed therapists broadly. There are licensed marriage and family therapists, but licensed therapists would not count for them. That's not their license. And we are not licensed therapists, we are licensed counselors. And so, because there is no license in the state that met that criteria, it would be written into law but the money would never come to those of us who could then utilize it to provide the services for the folks that they were, that they were seeking to support. So this is why this sort of central definition is part of the core of our work. Um, and if we don't advocate for ourselves, no one else will. And if we don't advocate, we have to presume too that if we don't advocate for the communities that we want to support, no one else will. We have to presume that it's very easy to push this stuff off and to say that somebody else should do it. It should be done, but I don't have time to do it. If we care about it enough, we have to invest our time and energies into it, or no one else will necessarily. Um, so how do we advocate? It can happen at all levels. You can advocate for things at the federal level, going to, Washington, D.C., talking to your state representatives to the federal government. We can represent ourselves at the state level. In Pennsylvania, we can go to Harrisburg, go to our capital. But really, a lot of advocacy efforts can happen at the local level. And so, how do you even begin? It starts with a phone call, an email, a knock at someone's door, something like that. Um, I'm a somewhat anxious person with communication. Like I don't love going out and uh, meeting new folks and introducing myself and like starting that awkward conversation off with, "Hey, can I have a moment of your time?" But you got to do it. And so I've gotten much better at it over time, just sort of like stepping in and saying, "Hey, how do I do this? Hey, I want to accomplish this thing. If it's not you, who can you point me to that would be helpful?" Um, and that's just how you do it. You just have to kind of rip the band-aid off and go and do. And the first time you do it, it's really awkward. And the 100th time you do it, it's probably still a little awkward. But it gets easier and easier as you do. So here's a picture from this is in Washington D.C. This was during trying to think of the year that this would have been probably summer 2018, um, maybe maybe summer 2019, but I think it was summer 2018. This was at the our nation's capital. The American Counseling Association puts on every year a day at the Hill at Capitol Hill, and so delegates from all over the country from our various state associations go to a sort of an extended weekend long learning conference in DC. And then ACA uses that as an opportunity for their government relations committee to have all of us go and talk to our various state um, legislative officials, to advocate for our various causes. I am, hopefully you can see my pointer right here, very, very top middle. I'm relatively tall. I'm right around 6 foot tall. And so they were going by height. And so there I am in the back with another gentleman who is also very, very tall, is actually standing one step below me. But that's me back when representing Pennsylvania. There's some other folks here too that are important representatives from our state. Let me see if I can find them again. So my colleague, there she is, Dr. Nellie Scanlon is right there. She's a professor with Carlow University in Pittsburgh, sort of bottom, um, second row back on as I'm looking at it, the right. There's some other folks though that are important. And I'm not going to find them all. We have a representative here who is from Pennsylvania who was a part of the Association for Multicultural Counseling at the ACA national level, former past president of the Pennsylvania Counseling Association. That's actually why I'm there. I was president-elect for the Pennsylvania Counseling Association that year. Dr. Scanlon was our current president at the time. There's also another gentleman somewhere in the room here who was a past president of the Pennsylvania Counseling Association. His career found him moving to Florida, and he was then either an incoming or current president of the Florida Counseling Association. And so many of these folks have found their way into national divisions of the ACA and into various other roles. So advocacy and action, as it were, all they're talking about our needs as professional counselors to then be able to go back and serve the communities that we serve. So that is advocacy at the federal level. We have an ethical obligation to advocacy. You see here I'm not going to read it to you. You're all adults, but these are considerations to how we represent ourselves. So, like, if you get a call from the media, for example, and your local newspaper wants to talk about mental health needs in your community, you can absolutely do that. I think it's great for you from a business perspective to get your name out there as a counselor, and sort of advocate for your practice. But also, it's great for our profession to have folks out there talking about this stuff. And so, though an important aspect of this is, uh, in advocating for our profession, we are representing our profession. And so you have to consider that any personal values, any personal belief systems that you have that can't be sort of validated, in place of our profession, which really shouldn't be talked about. That's for you individually. You have to then stipulate that this is coming from me, not the profession of professional counselors that are out there, because we don't want to misrepresent the profession. Um, I can remember, so my dad was a dentist, and the American Dental Association actually had regulations around like how big their signs could be, for their offices, like what like styles font and stuff that they could have. At least that was set out in their codes of ethics. And my dad was always really upset when he would see dentists in the area who were advertising inappropriately, because it was misrepresenting, like it was trying to kind of build up their profession as being these um, uh, more socially acceptable, less scientific places, is how he took it. My dad was a big stickler for rules. So, you know, so it's the case in other professions too. How we represent ourselves as professionals is something that the profession broadly takes a look at. And so when we're engaging in advocacy efforts, we have to keep in mind that it's not just us. We're representing all professional counselors in this case. And that's a good thing. That's not meant to be intimidating. I mean, it's meant to kind of get you thinking about how you represent yourself. I've also gotten comfortable with saying, like, I really can't speak to this issue. Our field doesn't have a stance on this that I'm aware of. These are the things that I know, but that's as far as I can really go with it. Um, this is my belief on that topic, but I need you to make sure that if you're quoting me on this, that you're identifying that this is a personal belief system and doesn't represent the entirety of, the counseling association. So, just things to consider, I think. Also under federal advocacy, so this is one of the little cars, little train cars that runs from the Capitol to the House and Senate buildings that are kind of a block away. And so as our various representatives need to go from building to building, they don't have to go outside. They can actually travel underneath. And so I don't know that this is the case anymore, because certainly after one particular incident a few years ago at the Capitol, I'm sure they've tightened down security and things like that. But when I went to the Capitol and was representing the American Counseling Association, we actually got to ride on the little train cars. Don't know if that'll still be the case, but some of the stuff that gets talked about, or that is currently being talked about, is licensure portability. So the counseling compact that's going on, that's something that ACA is constantly talking about, at the federal and state levels. Medicare reimbursement, which has gone through, but is still a subject of conversation to try to get us getting more and more folks into Medicare reimbursement. Veterans Affairs offices will now take on professional counseling licenses. These things weren't always the case. And it's all because federal level regulations are out there that just don't have our license attached to it, because the LPC or LMHC or whatever the case may be in your state, those licenses didn't exist when that legislation was being written, or were not sort of out and available as well when these pieces of legislation were being written. So they weren't written in. So we need to go and advocate, and at the federal level have our license included for consideration at various levels in order for us to be able to help the communities that we help. So keep in mind, in Pennsylvania, we have two Senate members elected. Right now, it's Senator Bob Casey, who's up for reelection recording this in 2024, so in this year. And we have Senator John Fetterman from the Pittsburgh area. And then we have 18 members of the House of Representatives. All of those people you can get appointments with in Pennsylvania and talk to them about this stuff. It's not always easy, especially our two senators, because they're two people and there's a lot of people who want to talk to them. But you are more than able to call their various offices and get an appointment on the books and have a conversation with them about the issues that are important to you. They're supposed to listen. Hopefully they do. Here's some more train cars. Just I thought they were great little pictures. So, and they do move relatively fast, which was kind of fun. State advocacy. As we get closer to home, I feel like it gets less press, but it's actually you're going to be dealing with issues that are much more um, pressing and present to you. So state advocacy, the governor has initiatives that the governor is working on. I know our current governor, Josh Shapiro, is kind of a champion of mental health issues. At least that is part of his platform. And so I've had a couple conversations with him, which is great, and would love to have more. Our lieutenant governor currently in 2024 is Austin Davis, and I've met Austin Davis before too. Again, you can have lines of communication to these folks. Not always easy, but something that you can indeed do. But we've talked, not in any sort of official capacity, but we've chatted a couple of times, and um, again, very supportive of the mental health community. That's important because if legislation needs to come through our state, we need them to sign off on it. Various state committees, various representatives in our own state level, House and Senate, and you have represented officials who are in your area that were, in your local jurisdiction that were elected into these positions. They have offices in your communities. You can talk to them and they will be on various state committees that they are either in charge of or are sitting on that are considering issues that are important to you, no doubt. And so it would be absolutely appropriate to try and have conversations with them and see where they can have influence. If something is going to be signed into law, it has to have, a various, political member to go and champion it and get it onto the floor for consideration and for vote. And I have that sort of, I am not a politician, so I don't understand the process super well, but I understand that legislation has to be sponsored by an individual, ideally, maybe even co-signed by multiple individuals. It has to gain some support to be voted, to be moved on to consideration for the floor. It goes to the floor for a vote, and the governor then has to sign to it or veto it. And there's various processes that go along with that. So none of it's easy. So here we have, this is quite a while ago now, but the Pennsylvania Counseling Association, similar to at the national level, has state days at the Hill. And so they will sponsor these opportunities for we Pennsylvania counselors to go and talk to our various, elected officials in Harrisburg. And then here is note, I had more hair. It's a few years ago, but this is Dr. Joe Bean, who's a graduate. Actually, all three of us are graduates of Duquesne University in Pittsburgh. Uh, Dr. Bean is a professor at Millersville University. There's me, and then Dr. Scanlon, I mentioned earlier, is a president or is a professor at Carlow University right now. And so we three went a couple of times to the state capitol to advocate for professional counseling needs and for the communities that we serve. Dr. Bean was our past president at that point. Dr. Scanlon was our president of the association, and then I was an incoming president. So I'm trying to think. We covered topics associated with LGBTQ plus community. We covered topics associated with various ethnic minority communities and legislation that was coming through for those areas. We talked about school districts. We got on the books with various members of the House and Senate who were working on different things in those areas. And so we were able to advocate as professional counselors for our profession to hopefully get more funding and more support back to our communities. All right, local advocacy. So this is the courthouse in Greensburg, in the city that I live in Westmoreland County. There So even if you don't have a county courthouse in your city like I do, there's going to be a city hall somewhere. And so it's an opportunity to go and talk to your mayor, to your city council. I've gone, it's public record. So like they will have monthly meetings that are open to the public. And so you can go and sit and listen and hear what, you know, what street's getting paved, where they're approving funding to put up some more traffic signs, what building is getting torn down, where money is going into different areas to support different initiatives. And they allow you, if you live in the area, to sign on and speak at council and share some information with those folks. I've signed on and shared, a couple of different things with them. Um, this is how we get resources through. And then at the county level, we have county commissioners, for example, and every county has three, one Republican, one Democrat, and one, one of, uh, to make a majority, one other member, who approve funding for all sorts of things and resource allocation for all sorts of things. Our Department of Behavioral Health Services, Department of Human Services, it's DHS now. It changes all the time. They get their resources from the county commissioners. So the courthouse, the mayor's office, the city hall, those are places where you can go to find some information about where resources are being moved and talk about what you're passionate about. Talk about the communities that you serve, that you feel need advocated for. Um, they are supposed to listen, and I've not been turned away. I've had folks who maybe don't agree with me. I have put out requests for action to different elected officials, and I've gotten official statements back that have said, we don't agree with that, and I'm not going to be, I appreciate what you've shared, which I don't necessarily believe. But we're not going to go forward with that effort. And so I remember it and I share that information along because they're supposed to be working for us. So, uh, you know, make sure to hold them accountable for these things. Outside politics, consider opportunities to coordinate with other professionals. So you can have a lot more bang for your buck, as it were, if you go as a group. My wife and I are involved with a couple different counseling sort of supervisory networks in the area. And so we talk all the time about, did you hear about this thing? Did you hear about so and so who's, you know, saying that they have resources. I read in the paper that, they found X number $1,000 for, these resources. Where's that going? And so it gives an opportunity to kind of share about what it is that we care about, what our clients need. It takes it all the way down to just you and your office and your network of people trying to make change in the communities in which we serve. So I just want to kind of point out that's the courthouse again in Westmoreland County in Greensburg. And then it's a slightly older picture. That court square has been modified recently. They did a big project there. But that picture is taken from that storefront, my favorite coffee shop right in town, right on Main Street. And so a lot of business gets done in that coffee shop. I've gone in there and I've, bumped elbows with our mayor, with our county treasurer, with a couple of the county commissioners, with various folks. And every time something needs to be done, they will go from the courthouse to one of our local businesses and sit down and have lunch with people and talk about it. I've gotten many of my meetings done by saying, "Hey, would you be willing to meet me at the White Rabbit for some coffee? I wanted to talk about this or that." And that's how business gets done. That's how advocacy happens, right? Right, advocacy in action, as people say. Impact of professional association. So I won't belabor this, but the American Counseling Association focuses at the federal level. They also send resources down to the state level. It's not as clean. It's not as clear, but if our state associations reach out, they will provide certain resources to us. But the American Counseling Association is focused on that big picture stuff at the federal level. Um, you know, advocating and speaking for counselors and the communities that we serve at a national level. The Pennsylvania Counseling Association is very active in our state with government relations needs. We have a standing government relations committee. They're always putting out, calls to action when we hear something is coming through. Call your local legislator. Here's a script, stuff like that. So if this is something that you feel passionate about, which I hope you do, this is how we make change. You know, you may be upset about this thing or that thing. We make change by advocating. Um, Very recently, uh, there was a change in how the insurance companies managed um, providing compensation for pre-licensed individuals. That was never a thing. When I was coming up in the field, you had to have a license to receive direct compensation from an insurance company. Through a series of events that I won't get into, some of the insurance companies were found to be paying unlicensed folks under an umbrella license, which isn't a thing that they did. They went to kind of step back on that and correct their error, as it were, but the state government stepped in and said, no, that's going to create a mental health crisis at this point. We need to figure out another way through. So the state government isn't necessarily in charge of the insurance companies, but if the state government puts forth a law, the insurance companies have to follow it if they intend to continue serving in that state. So our government relations committee got involved and was helpful in not not central, but helpful in having some of these conversations to get a mid-tier license approved in the state of Pennsylvania. Um, there's all sorts of opportunities to kind of make these changes. You never quite know, and so you have to be aware and monitor these things. And so, like, even just membership in your state association makes a huge difference because our government relations committee is completely volunteer run, for example. And so the only way we get funding for a lobbyist to be able to go and track this stuff in Harrisburg for us is through membership fees. It's really our only fundraising opportunity. So just stuff to sort of consider and keep in mind. Other things to keep in mind, I mentioned this, but your representatives at the local, state, and federal level should want to hear from you as their constituents. You vote for them. They should want to earn your vote. You can call their offices. They should respond to you somehow, whether that's, I've called and said, like, I want this thing to happen. And the administrative assistant will take a note. It's helpful if you know if the thing that you are advocating for um, has a number to it. If it's being considered for going to the floor, it will have a Senate number or a House number, for example. So SB something, Senate bill something, some number. That won't be the same as the House bill. They're not numbered the same. So it's something to kind of keep in mind. And then your senator is only going to care about the Senate bill, and your House member is only going to care about the House bills. You got to call both, but because it needs to be approved in both chambers. Uh, but it doesn't. You don't have to have a bill number to call and advocate, but that is helpful to know. It's something that I've learned as I've gone along. Votes from any political representative or public record. So if you're advocating for something or feel passionate about a certain community, a certain cultural group that you want to support, you can go and see if your elected official has voted favorably or unfavorably on those topics. It's every vote is public record. So helpful to know and helpful to, like, essentially hold them accountable for that stuff when they say, no, I definitely support that community. It's okay to say, yeah, but I looked up your record and you voted against that like 4 times. What's going on with that? I mean, I very much encourage you to be respectful, but it's appropriate to kind of question, use your counseling skills. So hopefully this has been a useful conversation about how to go about and be an advocate for the communities that we serve, the people and the places and the groups that you feel passionate about. Um, Keep in mind, it's very easy to be jaded. Um, there's many things that I put out there that I feel very passionate about wanting to serve and support, and they don't always get traction. But if we don't go back in um, and sort of support these efforts and find ways to refresh ourselves around them, it'll grind you up. So it's important to find like-minded folks to try to help you to vent about, etc. The business of counseling can be challenging with the work that we're doing. So, like, it's hard to get traction sometimes in our community agencies or in the community itself. Yeah, a lot of this stuff is financially driven, and that a lot of our services need to be lower cost to be able to help people. That doesn't mean that you don't deserve compensation for the work that you're doing, and so that mismatch can really challenge us. issues with recidivism, people who, our clients who come back over and over again um, despite our best efforts. That stuff can really grind us down. It can really, really challenge us with burnout. So what do we do with that? I recommend attending conferences, connecting with folks locally, having a coffee hour, a peer supervision hour, a book club, anything to kind of refresh you. Join and interact with your professional associations. Go to the PCA conference and talk to other folks. Join, if you have a preference around a particular issue that's affecting folks, see if there's a professional association with that. I've done some work recently with the different, treatment of sexual abuse organizations in some different states. They're very passionate people who very much want to figure out new ways to help folks. That can be energizing. Stay current in the field and avoid drift. It's very easy when you get into an agency or a group practice to start practicing the way that everybody else does and to forget about all the stuff that you've learned in your counseling program, all the stuff you hear about at conferences. Try to stay current, try to stay connected. Avoid that drift that happens where people just get into the routine of what they're doing. And definitely be advocates for the areas that you feel passionate about. Remember what I said at the beginning: if you don't do it, nobody else, just presume no one else is going to do it. But if you start putting yourself out there, it's amazing the number of people who will come and join you, to try to help. So hopefully this was a an interesting and useful conversation about counseling advocacy. I very much encourage you to be advocates. It's a part of our DNA as counselors. Certainly reach out if I can be of any help, but great talking with you about this.